the Q&A as well on certain components and getting input from others in relation to that. So why Cairn Miller? So Cairn Miller is a pioneering psychology and counselling institution in Australia since 1961. One of the benefits of Cairn Miller is that there is flexible study options. And one of the things in particular which is relevant for this course is that it is delivered completely online, which is really exciting. And also as well, there's, I guess, a greater degree of flexibility regarding the engagement. The lecture materials are actually pre-recorded and self-paced for the different weeks. So for people that are currently working in different roles, they don't need to log online each week at certain times, because I know that's a busy thing when we engage in postgraduate study. It's finding where it's going to fit into our existing life. And that's one of the really flexible things about this course in particular, which is great. With Cairn Miller as well, you do learn from experts and practitioners, and I think it's a really strong beneficial aspect of Cairn Miller and this course as well, is that you're learning from individuals that are not only working in academic environments, but also working in professional roles as well. Myself, as an example, I work as the course coordinator and senior lecturer at Cairn Miller, but also I'm a psychologist in private practice as well. And I think one of the beneficial aspects of Cairn Miller is there's a nice balance of clinical experience and clinical expertise, but also academic expertise and research background as well. We have a whole range of high quality facilities and really good student support and above national average ratings at the Cairn Miller Institute. We have tailored support services. We've got really good engagement with our student support services, research and career advice. There's a whole range of other professional development and lifelong learning opportunities at the Cairn Miller Institute. It is a not-for-profit as well, so donations and tuition fees are often given back to the community in different ways. And we really strongly emphasise through our approach here at the Cairn Miller Institute the triple helix in terms of training, research and clinical practice. So really speaking from clinical expertise, and in particular this course, I've often drawn upon my own clinical experiences working with particular individuals and clients across multiple different settings to inform not only the content, but also the way that we discuss the different units as well, which is really exciting. So just a little bit about me. As I mentioned, my name's Liam Spicer. I'm the unit coordinator and the course coordinator for the postgraduate certificate in trauma-informed care. I'm a senior lecturer here at Cairn Miller and primarily work in the area of trauma and grief. Also work a lot with different marginalised and minority groups, autistic and ADHD individuals, different cultural backgrounds, and the LGBTQ plus population. I'm also accredited EMDR consultant in schema therapy and really enjoy teaching, training and research in these areas. In my spare time, I really enjoy spending time with family, my dogs and traveling as well. And yeah, really emphasize throughout the course the importance of self-care and balance in the work that we do. So a little bit of an overview here of the course is that the postgraduate program does really provide you advanced trauma-informed care knowledge across assessment, interventions, and systemic applications of trauma-informed care principles, and going to break down a little bit more around the different units that are on offer as a part of the postgraduate certificate in trauma-informed care. And just be able to throw it over to Jasmine as well to get their input around some of the things that they've perhaps learned or reflected on throughout different units so far. So as I mentioned, it is an online program which involves recorded lectures structured over 12 weeks. Also as well, in addition to that, we have a weekly drop-in session. So this is actually a session where I go onto Zoom and any of the students can drop into that session. And that session's a really good opportunity to be able to come and connect with others, be able to come to the session and ask myself any questions, whether it's about the contents that you've been learning from that particular week, whether it's about the assignments or any of the other course material in general. The course is offered part-time, currently over 1 year, and quite a flexible schedule as well. And I'll break that down soon in terms of some of the units. Before I go into the unit so far, I might even throw it over to Jasmine at this point and yeah, get your input, Jasmine, if that's all right, about, I guess, how it's been in terms of having it flexible, where you've been able to sort of watch the lectures in your own time, and also perhaps how you found the drop-in sessions as well throughout the semester, if that's okay.
Yeah, I think one of the benefits of this course was the flexibility. I think whenever you're working or juggling, you know, other things at home, it can be really important to have that ability to watch the lectures in your own time, and not feel like you have to attend every week at the same time, because we know that life happens, and so it makes the course a bit more achievable in that way too. Um, Definitely the drop-in sessions have been helpful every week because you don't have that, um, one-on-one or a group session. It gives you that ability to touch base with the lecturer, but also the other students in the course as well. It can be very reassuring at times to know that you are on the right track with things, whether it's assignments or just the content in general. And I know that I've used it quite often, and it's been quite good, just that peace of mind, and getting that support. You don't feel quite alone, which is
Hmm.
good. Yeah.
Yeah, thanks for sharing, Jasmine. It's one of those things sometimes when we do online people. So I think it's a really nice balance in terms of having the flexibility and being able to do those online recorded lectures, but also at the same time then having the opportunity to come and connect with other colleagues and get some additional support and guidance as needed. So thanks for sharing that, Jasmine. Um, so I'm just going to chat a little bit about the course overall and a little bit about the structure. So overall, at the completion of the course, students who satisfactorily complete the course will be able to demonstrate skills and knowledge in the following areas. So firstly, really demonstrating an understanding of specialist trauma-informed theories and models, fundamental for work with a wide range of diverse populations. Also, as well, sort of critically analysing the application of trauma-informed principles to current assessment processes, treatment planning, and also interventions. Integrating theory and practice, so not just the learning and the knowledge that you're getting from units, but also how that's applied into practice in different settings, to really inform your approach. Demonstrating crucial reasoning, judgment, and problem solving, in particular with a range of professional, legal, regulatory, and ethical practice issues. Communicating clearly, effectively, and professionally, and self-motivated and self-directed learning principles that facilitate lifelong learning. So overall, in terms of the course outcomes and structure in some sort of career opportunities in particular, graduates of this program will be well positioned to work across diverse fields requiring trauma-informed expertise. It may be a current setting that you're already working in, where you're working with trauma already, and it can really provide sort of more specialized and a higher level of knowledge and skill base. Maybe it's an area that you're really wanting to go into more in terms of being involved in the trauma field in some capacity. And there's a whole range of possible roles and benefits that come from engaging in this course in terms of your knowledge and skills. One particular area overall, which is a really direct one, is things like trauma counselling and therapy. So roles in private practices or mental health clinics, community health centres, etc. For example, social work and case management and other allied health positions. As you mentioned, Jasmine works in a family sexual domestic violence area. So a lot of the content and knowledge from this unit has been able to assist in that particular role. And it can also help in terms of other positions, child protection, domestic violence support services, refugee resettlement programs. It can also be as well useful, and I'll chat about some of the units in particular relating to this, but also as well in terms of organisational leadership. So for people that are really wanting to upskill their knowledge of trauma, if they're perhaps a leader or a manager of an organisation, that can be particularly a really good career prospect as well from the course. So for example, implementing trauma-informed policies and practices in workplaces, supervisory roles. But a lot of the content does apply to a lot of the general health-related industries. So just wanted to do a bit of an overview of that. But if people have specific questions, we'll certainly be able to go over those. So here's just a little summary here of the course structure and units currently. So this particular semester so far, we've focused on the Foundations in Trauma-Informed Care unit, and also at the same time, the Trauma-Informed Assessment, Treatment Planning and Recovery unit. Next semester, we'll be focusing on intergenerational trauma and trauma-focused interventions. And then there's an elective option between either engaging in the trauma-informed care and family, domestic and sexual violence unit, or the trauma-informed care and leadership unit as well. So it's nice in the sense that people can have a bit of a selection or choice regarding which unit out of those second two is going to apply most to their career goals or current position of work in some way. So I'm just going to do a little bit of an overview of the units that we've covered so far, but more importantly as well, 2 of the units for next semester for people wanting to enroll in those. For people that do enroll in this coming semester, semester 2, you'll then have the opportunity to engage in the next 2 units I'm going to cover in semester 1 next year. So it is flexible in that sense. You don't have to start the course at the start of the year. You can actually start in semester 2. So for TRC 401 Foundations in Trauma-Informed Care, the overall aim of this unit is to assist students in developing a foundational understanding of trauma-informed care, including its theoretical, empirical and practical underpinnings. So we spent a fair bit of time going over, I guess, definitions and understandings of various forms of trauma. We've talked about lots of different trauma-informed care models. We've talked about theories and approaches of understanding trauma beyond just the DSM. We've also really focused a lot on how to be adapting our approach when working with trauma survivors from different backgrounds, whether that's cultural, individual differences, or other particular identities. So that's been really good. And we've been able to also learn about things like the neurobiology of trauma, the impact of trauma in different ways across the lifespan. So it's been a really broad and important unit going over recent research and updates and best practice ways of working in the trauma-informed care space. Would you like to touch on, Jasmine, at this point, maybe, I guess, any reflections or things that you've found useful from perhaps the first unit before I move on to the next one?
Yeah, sure. I think that that's a very good summary of the unit. So we definitely have touched on a lot of things, but it's not as overwhelming as that each unit, each lecture goes through those particular topics in detail. And Liam's very good at breaking that information down in a way that's easy to understand, and giving lots of examples of how that might be used in our work and in our practice. In particular, the trauma theories, there are a lot of them, but they're a great insight into how we can use them with our clients. But we know that later on in the units, there's going to be a bit more in-depth view of those, which is exciting, more to learn.
Right, thanks, Jasmine. And it's a really good point you mentioned because we're really trying to make this unit practical and applied as possible. It's certainly not a unit which is just about acquiring knowledge. It's also about acquiring, well, how do we adapt this in the different roles that we're working with and apply it in our day-to-day work, whatever that may be. So thanks for sharing that. For TRC 402, this is trauma-informed assessment, treatment planning and recovery. So the unit overall has really equipped students with the skills to conduct trauma-informed assessments, develop effective treatment plans and implement evidence-based interventions. We've gone over a whole range of components there regarding sort of cultural considerations and how do we adjust trauma-informed interventions and assessments. We've also understood as well, I guess, co-occurring mental health challenges that often come with trauma. We've been able to learn about things like attachment and dissociation and how they relate to trauma. And we've been able to provide a bit of an overview of different trauma-focused treatments as well, like EMDR and trauma-focused CBT, and really looking at some of the important applications and skills that you might be using with trauma survivors directly. So yeah, similarly there, Jasmine, is there anything you wanted to share about that unit or anything you maybe found useful or any reflections?
I think this one in particular does break down how we look at that assessments case formulations and then into that treatment planning with the clients, and really looking at that trauma-informed aspect of creating that safety and building that rapport with the client, considering all elements of their trauma history, how we gather that information in an appropriate way, and using that collaboratively with the client when we're looking at goals and therefore the interventions that we may think are appropriate, but obviously checking in with the client each step of the way. So this one's quite useful in bringing elements of TIC 401 into how we actually do an assessment with a client, and therefore the next steps moving forward into those trauma interventions. So this one's, again, a very practical unit, and some of the assessments that have been involved in this are very practical in that way too.
Great, thank you, Jasmine. So I'm going to move on here now and talk a little bit about intergenerational trauma and trauma-focused interventions. So that's going to be a unit that's going to be focused on next semester, really understanding lots of different perspectives and lived experience and frameworks regarding intergenerational trauma, but also then breaking down different trauma-focused interventions and their application. So that's going to be a really important unit next semester. And then there's going to be the option between the trauma-informed care and family, domestic and sexual violence unit, which is going to be really exciting in terms of understanding and working and upskilling in this space. And also the trauma-informed care and leadership unit as well, really building on leadership theories and how we apply this in different organizational practices and our everyday work as a leader. How we're going to learn overall throughout the course. So there's obviously the weekly lecture, there's weekly engagement with reading and resources, the engagement with assignments. And as Jasmine mentioned there as well, it's not your typical degree or university course where you're doing perhaps sort of essays or lots of written assignments. We've really tried to keep it very practical and engaging with some creative infographic assignments, some video assessments, some really stuff that's applied to your practice. So I just wanted to mention that. When we have the optional weekly drop-in session as well, as we've already highlighted. Also as well, it's really exciting that we're actually going to be launching next year the postgraduate diploma. So for people that complete the postgraduate certificate, they can actually then continue with things in the postgraduate diploma. And that's going to include a unit specifically on training regarding EMDR, a unit in actual training and skills in other trauma-focused interventions, and also some units on advanced trauma knowledge and trauma-informed research. So that's an opportunity as well for people that want to continue on afterwards and even gain further skills and knowledge. So the graduate certificate provides, obviously, as I just mentioned, pathway to advanced qualifications like the graduate diploma. It gives you specialised skills for diverse roles. And graduates overall will possess specialised expertise in trauma. As we know, that's really important in a lot of health and allied health roles. It also gives a lot of practical skills, and a really big part of the course as well is cultural awareness and cultural humility and understanding individual differences and their intersection with trauma. There's a whole range of different student support options, tailored activities and academic support, learning equity. So you can certainly as well get some further information on that if you're needing that. But at Can Miller, we really pride ourselves on being able to provide the best student support possible for students. Here's some of the entry requirements as well. And if there are particular questions that you may have regarding these entry requirements, feel free to send them through, or even after the session you can certainly send emails through as well regarding that if you have any further queries or things that you want to investigate. But generally a minimum 3-year Australian bachelor degree in a related discipline with at least 60% average marks, or a minimum 3-year Australian bachelor degree with some relevant work experience, or successful completion of a diploma or advanced diploma with at least 1 year's work experience in a relevant field. But if there are questions around that and your eligibility and enrolment for the course, certainly feel free to reach out to the great team. We'll be able to assist you with that.
So I'm just gonna, sorry, Liam, I'm just gonna pop in a question that's come through, and I passed on to our Q&A. Someone's been asking, was it, and this is more for Jasmine, was it easy or has it been easy to balance work with your part-time studies at the moment with the workload?
Yeah, it does take time and energy at the start of the unit semester to really think about how you're going to manage that. So for me, I picked, say, 2 days out of the week that I knew I could dedicate the hour or two needed to listen to the lecture, and then definitely picking some time on the weekend to do some of those more readings, and then gradually working on those assessments as well. So I think going into it, knowing when you might be studying and putting that time to it is quite helpful to get that balance. For me, I knew during the work day wasn't going to work, so I had to use the after work time to complete that.
Thanks. And I can see someone has also asked a question around the benefits of studying online and what those drop-in session schedules are like. Jasmine, I can see you're in the middle of
I was typing, but I'll answer it now.
Feel free to, I know you're in the middle of typing, so feel free to finish that answer and just post it. In the meantime, while you work on that, Liam, I might pass a question on to you. Someone's been asking, what do you think you'd be able to do with the degree after graduating in terms of either work and employment or potentially trying to then get into research?
Yeah, it's a really good question. So I think it can really help in terms of building up your skills and capacities and really being able to market yourself as someone that has additional expertise in trauma fields. So if you're wanting to work specifically in mental health roles as a counsellor, or if you already have a degree in psychology or social work, certainly I think that would help quite a lot in terms of then taking your expertise and knowledge level to another base, which is really, I guess, attractive for particular employers. We know these days that a lot of health-related roles, they're actually specifically looking for people that do have that trauma knowledge due to the prevalence of trauma, due to the impact of trauma. So I think it can really help out in terms of sort of those different roles that you might want to engage in. And yeah, it depends on what existing background you have as well that's then going to impact or inform what specific roles may come from it. If you've already done another degree like social work or psychology, for example, or a counselling degree, obviously there's certain roles that are going to be open to you from doing this course. Will be perhaps working in a sexual violence or domestic violence area, or you might want to work in a private practice and you can market yourself as someone that has that trauma expertise, which often helps in terms of generating referrals and being able to be quite busy as a practitioner. So it really quite depends on some of those factors. But yeah, I think it's becoming increasingly common and important to have knowledge and extra skills in the trauma space. Regarding research, it's a really good question as well. And we are going to actually have a specific research unit in the postgraduate diploma. So certainly as a part of that unit, and then maybe some of our plans even after that, we may even have the capacity of doing research projects as a part of further study, but also as well, depending on your existing background as well, having that expertise in trauma could certainly assist you with getting research-related jobs in the trauma space, because having that foundational understanding of trauma and its diverse application, it's going to give you, I guess, a lot of skills and knowledge to be able to work in trauma-related research roles at different organisations if they are looking for people as well. Hopefully that answers your question.
Thanks, Liam. That was very in-depth. A few other questions have kind of come through the Q&A, which we've been typing some answers to as well. But if you do have any more, we still have a couple of minutes, so feel free to use the Q&A channel to ask a couple of other questions. But otherwise, Liam, I'll pass it on to you for some of those final next steps and wrap-up comments.
No worries. So go on to next steps now? Yeah, perfect. So yeah, the applications are now open, and you can certainly check our website for dates for the certain dates and cutoffs for those for semester 2. So please visit our website there. And applications will be reviewed immediately for enrolment. You can gain further information as well about contacting our applications team. So if you do have particular questions about eligibility requirements or anything else, feel free to contact our team and they'll be able to really help you out with those. So that was pretty much it in terms of wrap up. So certainly there's plenty of time if people do have further questions or they want to understand anything else about the course, certainly get in contact with any of us at Candler, and we can certainly help you out with that, and looking forward to meeting you on the course if you wish to enroll.
Thanks so much, Liam. Before we wrap up, Jasmine, I'm just going to put you on the spot a bit and ask you to share, just again, as that current student, do you have any kind of key takeaways or highlights from the first semester, or from, your first semester so far? And additionally, any, I guess, advice you would have to someone who's considering applying to the new grad cert?
Yeah, I think that for someone like myself who hasn't done study in a couple of years, obviously it can be daunting to step back into that space. We know that it takes a whole different part of the brain to jump into studying a course, especially while you might be working or juggling other things in life. But I think do it because it's rewarding. You learn so much. In particular with this course, I already see the benefits in my day-to-day practice as well, and very excited about the diploma part of it too, and going into some more, EMDR in particular. I think this course offers something unique in the terms of diving into those trauma therapies, whereas sometimes other degrees are very much more just overviews. So I think if you come from a background of whether it's counselling or community services or something like that, this offers that next step, especially in a trauma space. And I think it's really, important that, someone's taken on board doing a course like this. Being very diverse. So yeah, I think it definitely has its benefits, but I think, definitely ask yourself the question, does this fit into what I'm currently doing? Am I going to give it the time and energy that it needs in order to get the benefits from it? Yeah.
Amazing, thank you. I know a lot of our attendees have commented that it's really helpful to have that student experience and that student voice. So thank you again, both of you, for your time and your insights today. As you'll all have heard, and as Liam shared already, in terms of next steps, definitely don't hesitate to reach out to our course coordinator if you have any questions about the teaching and learning aspects of the program. But I also wanted to encourage anyone who's considering applying to reach out to our applications team as well. You can book a one-on-one admissions consultation, which gives you some support, not just in terms of the course and the content, but also the logistics of how to apply and what those next steps might be. So please don't hesitate to reach out to our team. You can see some of the contact details shared today, and we'll also make sure to follow up with all of the folks who have attended with some more information about what might be on the horizon for you. Outside of that, we've given it one last call for Q&A. So if there are any final questions, you've got a couple of seconds now to send them through. But otherwise, I just wanted to thank again Liam and Jasmine for their time and their insights. We'll make sure to follow up with all of the attendees today, as mentioned. But if you do have any other questions, please don't hesitate to reach out to either our applications team or to Liam himself. With that being said, I'll wrap it up just with final thanks. Looking forward to seeing more questions and more applications from all of you in the future. And don't hesitate to reach out if there's anything else we can do to support. But for now, I'll end the session and enjoy the rest of your evening to everyone who's here today. Thanks again, folks. Bye for now.
Thanks, everyone. Bye.